At National Taiwan University Hospital, precautionary measures are being taken for the novel coronavirus. Face masks are now required for all visitors. And for the first time since the 2003 SARS outbreak, the hospital has opened its dedicated epidemic clinic. This clinic is located away from the main hospital building to reduce the risk of viral transmission. This outside facility will provide diagnostic testing, and it will divert patients with the virus into quarantine for treatment.
NTU Hospital has sealed its main entrance, leaving only a small door open to patients. It's to ensure that every person who walks in is wearing a mask. For the first time since the SARS outbreak, NTU Hospital has opened an outpatient clinic dedicated to an epidemic.
The
first patient category is those who had traveled to China's Hubei, those who traveled to Wuhan. These are high risk. If they arrive at NTU Hospital, we will ask them to go directly to the emergency room. The other group is patients who have China but not Wuhan or Hubei in the travel history. The purpose of the epidemic clinic is to allow this patient group to get care directly at the clinic. The third category is patients with no recent travel history to China. If they have a fever, they should proceed to the usual clinic inside National Taiwan University Hospital.
NTU Hospital began diverting patients to the epidemic clinic on Wednesday. Patients who test positive for the novel coronavirus will be sent for treatment via an isolated passageway.
If the situation is truly on the dangerous side, we'll try our best to have the patient outside the hospital. Of course, in the end, the patient will enter a passageway. We have already charted out the path. This path exposes as few other patients as possible. Also, we will have all the protection equipment in place to prevent the virus from having the opportunity to spread. Patients who don't have a fever will feel more at ease making their way around the hospital. Patients who do have a fever won't have to worry that they'll spread the virus to others.
NTU Hospital says it's tackling the virus head-on with diversion measures that reduce the risk of public exposure.